Gentlemen, if you've been looking for a safe, science-driven way to strengthen your erections without jumping straight to prescription pills, listen closely. There's a specific combination I now reach for frequently in my clinic because it supports the biology that actually powers erections, and it does it in a way that aligns with how your body is designed to work. An erection is a vascular event, first and foremost. When you're aroused, nerves in the penis signal the release of nitric oxide, which relaxes smooth muscle, opens the arteries, and traps blood in the erectile chambers. If nitric oxide is in short supply, or if the lining of your blood vessels is unhealthy, blood flow is compromised and firmness suffers. That's why I like to start by improving nitric oxide production and protecting the endothelium, the delicate inner lining of your blood vessels. Do that well, and you don't just help the penis, you help the entire cardiovascular system. Here's the approach. I favor L-citrulline as the core ingredient, not L-arginine. Your body converts L-citrulline into L-arginine in the kidneys, and from there into nitric oxide. Paradoxically, L-citrulline raises blood L-arginine levels more reliably than taking L-arginine itself because it bypasses the first pass breakdown in the gut and liver and avoids heavy metabolism by an enzyme called arginase. In other words, you get more of the raw material where it matters, with steadier levels and fewer gastrointestinal issues for most men. Does it help in the real world? In clinical research, men with mild erectile dysfunction who took L-citrulline reported better erection hardness and more successful intercourse attempts compared with placebo with minimal side effects. Several more recent reviews suggest the benefit is modest on its own, strongest in mild cases, but it's consistently positive and, importantly, it targets the same nitric oxide pathway that prescription PDE5 inhibitors like sildenafil or tadalafil rely on. That means improving nitric oxide can also make prescription therapy work better if you need it. Dose matters. Many of my patients do well with around 3,000 milligrams per day, often split into 2 doses. Some use 1,500 to 3,000 milligrams once daily. It's generally well tolerated. If you notice stomach upset, take it with a small snack or split the dose. Give it a fair trial. Think in weeks, not days. Most men who respond notice clearer morning erections and better rigidity within 2 to 4 weeks, with additional gains over 6 to 8 weeks as vascular health improves. Now, nitric oxide is fragile. Oxidative stress, common with aging, high blood pressure, diabetes, smoking, and poor sleep, neutralizes nitric oxide before it can do its job. That's why I pair L-citrulline with polyphenol-rich antioxidants that help preserve nitric oxide and support endothelial repair. 2 with some of the better evidence are grapeseed extract and quercetin. Grapeseed extract is rich in oligomeric proanthocyanidins. Multiple human trials and meta-analyses show it can modestly lower blood pressure and improve flow-mediated dilation, a measure of endothelial function. There's also evidence of mild antiplatelet activity, which is one reason I screen for blood thinners before recommending it. By easing oxidative stress in the vessel wall and helping the endothelium respond to shear stress, grapeseed extract creates a friendlier environment for nitric oxide to act. Typical daily amounts in research range from roughly 150 to 300 milligrams of a standardized extract. Quercetin is a flavanol found in apples and onions that's been studied for cardiovascular effects. Controlled studies show small but meaningful reductions in blood pressure and improvements in endothelial function, including after high-fat meals when blood vessels are most stressed. Mechanistically, it appears to enhance nitric oxide synthase activity and tamp down enzymes that generate free radicals. The practical upside for you is better vasodilation and a more responsive erectile tissue bed. Common daily doses are 250 to 500 milligrams. Formulations that improve absorption, such as phytosome complexes, can be helpful. Put together, L-citrulline provides the substrate for nitric oxide, while grapeseed extract and quercetin help protect the nitric oxide signal and the lining of the vessels themselves. I use this combination because it addresses the two sides of the equation, production and preservation. Clinically, I see the best results in men with mild to moderate vascular-related erectile issues, especially those with borderline blood pressure, early metabolic syndrome, or a history of smoking. It's not a magic bullet, but it's a rational, body-compatible way to stack the deck in your favor. A few common questions come up, and they're important for safety. First, why not just take nitric oxide or rely on nitrate products? Nitric oxide is a gas your cells make on demand. You can't take it as a pill. Organic nitrate medications like nitroglycerin are life-saving for chest pain, but can cause tolerance with chronic use and must never be combined with PDE5 inhibitors due to the risk of dangerous drops in blood pressure. Dietary nitrate from vegetables, like beetroot, can support blood pressure and athletic performance, and I'm a fan of a vegetable-rich diet. But for erectile function specifically, the evidence for beets alone is mixed, and it doesn't replace the need to restore the L-citrulline L-arginine nitric oxide pathway and endothelial health. Second, why not L-arginine? It can help some men, and there's data supporting it, particularly in combination formulas. But gram for gram, L-citrulline is more reliable at raising arginine and tends to be gentler on the gut. That's why I reach for it first. Third, can you combine this with prescription therapy? Often, yes, and it can be synergistic. PDE5 inhibitors need nitric oxide present to work well. If you've had a partial response to medication, improving nitric oxide and endothelial function may turn a so-so result into a confident one. Always loop in your prescribing clinician so we can monitor blood pressure and adjust doses if needed. Let's talk precautions. If you take nitrate medications for heart disease or use recreational nitrites, do not combine them with PDE5 inhibitors, and be cautious with any vasodilating supplement. If you're on antihypertensives, start low and monitor for lightheadedness. Grapeseed extract can have mild blood thinning effects. If you're on warfarin, direct oral anticoagulants, or antiplatelet drugs like clopidogrel, get clearance from your cardiologist. If you have advanced kidney or liver disease, or you're scheduled for surgery, check with your physician first. And if you develop chest pain, new shortness of breath, or erectile dysfunction that comes on suddenly and severely, seek medical care. ED can be an early warning sign of cardiovascular disease. Choosing a product wisely matters. Look for L-citrulline at or near 3,000 milligrams per daily serving, grapeseed extract standardized for proanthocyanidins, and quercetin in a well-absorbed form. I prefer brands that are third-party tested for purity and potency. I don't have financial ties to supplement companies, and I don't accept sponsorships for my clinical recommendations. My goal is simply to help you use what works and skip what doesn't. Now, supplements help most when they ride alongside the fundamentals. Erections are a barometer of overall vascular health. The men who get the biggest and most durable improvements pair this protocol with consistent exercise that raises heart rate, resistance training 2 or 3 times a week, a Mediterranean-style diet rich in vegetables, olive oil, and fish, 7 to 9 hours of quality sleep, and smoking cessation. If you snore or wake unrefreshed, get screened for sleep apnea. It's a frequent, fixable saboteur of erections. Keep alcohol moderate and manage blood sugar if you're pre-diabetic or diabetic. High glucose is toxic to blood vessels and nerves. And yes, hormones matter. If your morning erections have disappeared and your libido is low, ask your doctor about a hormone workup, including testosterone and thyroid. If you're ready to try this approach, give it a consistent 6 to 8 week run. Track morning erections and erection hardness during sex. Those are the earliest signs you're on the right track. If you're not seeing meaningful change, or if your ED is severe from the start, don't wait, get evaluated. Sometimes the fastest path back to confidence is a combined plan that includes prescription therapy while we work on the root causes. Everything I've shared is meant for general education and not a substitute for personal medical advice. But if you've been searching for a smarter starting point, a well-dosed L-citrulline plus grapeseed extract and quercetin protocol is one of my current go-tos. It supports the natural physiology that creates an erection, respects the bigger picture of your cardiovascular health, and for many men, delivers results you can feel. If you found this helpful and want more evidence-based guidance from a urologist on sexual performance, hormone health, and longevity, stick around. And if you're dealing with a complex case or multiple medications, reach out to your own doctor or a urologist who can tailor this to you. You deserve reliable answers and your best erections without guesswork.